Melissa. How are you today?
Good, how are you?
I'm doing well, thank you. My name is Megan. I'm an occupational therapy assistant student, and today I'm going to be working on some bed mobility with you. I'm just going to kind of observe how you move in bed, make sure that you're doing so efficiently, comfortably, and safely. And then we're actually going to get you up out of bed. We're going to get you practicing some lower body dressings. We're going to put sweatpants, socks, and shoes on using some of our adaptive equipment here. And then we're going to get you moving around with your walker and get you seated in a chair today. Does all of that sound good?
Yeah.
Excellent. I am going to take a minute to wash my hands. I will be right back. All right, so before I get you moving at all today, I do want to ask you, are you experiencing any pain at all?
I am.
Okay, can you rate that pain for me on a scale of 0 to 10, 0 being no pain at all, 10 being severe?
Probably about a 3.
A 3, and is it mostly located at that incision site?
Yes.
Speaking of, where is your incision?
Right here.
Yes, it's in the front of that right hip, correct. Are you aware of all of your surgical precautions that relate to that incision?
They told me, but I forgot.
Okay, so the first one is you can't bend your hip past 90 degrees, so you don't want to sit straight up, you do want to lean a little bit further back. The next one is you can't do any rotating of the hips, so we want to avoid turning that right foot to the right or left. We want to keep those toes pointed towards the ceiling. And then the last one is no crossing of the legs. It's no abduction, so you can't cross those legs at any point. Do all of those make sense to you?
Yes, they do.
Yeah, can you repeat them back to me?
No bending your hip past 90, no
Correct.
rotation, no crossing legs.
Perfect. Okay, so we're going to go ahead and get you up and seated at the edge of your bed.
All right.
We can do this in one of 3 ways. The first way is I can actually lend you my gait belt, and you can get it underneath your affected leg and swing it over the edge of the bed. The second way is you can do it entirely on your own in whatever way you feel most comfortable. However, it does have to honor all of those precautions. And the last way is I can provide a little bit of assistance and help get you out of bed. What would you prefer today?
Could you help me with that?
Yeah, absolutely, especially because it's our first day together. So I'm going to set this gait belt aside. And I'm actually going to lower this bed rail just so it's not in your way. Okay. So, first and foremost, I want to make sure that you're able to move efficiently in bed. So you can actually rely on your left leg a little bit to help you.
Okay.
So what I want you to do is go ahead and bend your left knee, pointed toward the ceiling. Perfect. And what I'm going to look at first is bridging. So you can prop yourself up on your elbows a little bit. Nicely done. And what I want you to do is, using the heel of that left foot and your elbows, bring your hips to the ceiling. Good. Good. And now I want you to use that same technique and scooch towards the foot of your bed. Good. Keeping those toes pointed to the ceiling, and you can scoot toward the head of your bed. Very nice. Okay, so now I'm going to have you utilize that same technique, the bridging and the scooting, and I want you to scoot towards me as far as you can. I know that railing's not there, but I'm right here to catch you should anything happen. Perfect. So what I'm going to do is I'm actually going to come up by your shoulder here, and you can actually straighten this leg now. Perfect. And I'm going to get underneath your legs here, and on the count of 3, I'm going to help push you up here, swing these legs here. What I want you to focus on the entire time is making sure those toes stay pointed toward the ceiling.
Okay.
And then when you do get to a seated position, make sure you're leaning back a little bit so you don't pass that 90-degree angle. Are you ready? Yep. All right, 1, 2, 3. Good. How did that feel? Good. Good? Feel comfortable?
Yeah.
Perfect. All right, so I'm going to start you off by getting your sweatpants on. So I'm going to introduce you to your first piece of adaptive equipment. However, I am going to go ahead and get you in your gait belt first, and we'll talk more about that reacher in a little bit here. This should fit you nice and snug. However, it shouldn't cause you any pain or discomfort. You can go ahead and lift your arms. So if it does, just let me know, and I'll loosen it a little bit. Good. I'm going to tuck the end in over here just so it doesn't get in our way at any point. All right. Coming back to that reacher, have you ever seen one of these before?
I have.
You have? Do you know how it works?
Don't you use this to help grab things?
Yes, so you're going to use that trigger right there to pinch and release. This is what's going to be picking up the objects. Yes, very nice. And then I do want to inform you that you've also got a hook here, which is going to be useful in pulling or pushing objects. Okay, we're going to talk a little bit more about that later. You've also got a magnetic piece on the end, so in case you happen to drop anything metal, you can rely on that to help you pick it up off the floor. Okay, so I'm going to hand this back to you.
Alright.
I want you to go ahead and reach for those sweatpants. Excellent. Perfect. And I want you to go ahead and unfold those for me, please. And I want you to focus first on that right side. I'm going to have you go ahead and bunch the right pant leg up to the top.
Okay.
Yep. Good. You want to create an opening large enough for the reacher to fit into and your foot. Good. So you can go ahead and place that reacher on the inside there, grab hold of it nice and tight, and then lower those pants to the floor. Good. So what's important here is you don't want to wiggle those toes to get them through the pant leg. You want to keep those toes pointed to the ceiling. Very nice. Yep, you can release that reacher just a bit. Once you get it up high enough, you can pull it out the rest of the way with your hands. Very nice. And then you can put the other leg through however you so choose. You just have to make sure you maintain your precautions, so don't lean too far forward. Very nice. And we're going to pull them up the rest of the way once we get you in a standing position, okay? So you can leave them right where they're at. Next, I want you to go ahead and take your reacher and reach for your socks there on the floor. Good. And now I want you to come over here and reach for this white piece of equipment. Good. Have you ever seen one of these before?
I haven't.
Okay, so this is what we call a sock aid. I'm going to steal this from you for just a second. We've got two nice black handles for you. These are going to be useful in lowering the equipment to and from the floor. And then your actual sock will go on this part of the equipment. And you always want the heel to be in the back of the equipment, okay? So I'm going to hand this back to you. And I want you to go ahead and grab that right sock. And I want you to slip it over the top and make sure you pull it nice and tight so that the sock is all the way on. And then you can go ahead and take hold of those black handles and lower the equipment down to the floor in front of that affected foot. You can bend the knee just to get your foot into position. Just make sure you're not turning those toes at all. Good. So go ahead and slide your foot in. I want you to pause right here. I'm going to have you pull back on the equipment first to get the sock into place. And then once you've reached the back, you're going to pull up to get the heel of your sock over the heel of your foot. Move nice and slow. Good. Is that on all the way?
Yep.
Excellent. How'd that feel?
Good.
Good. How's your pain level?
Still same.
Still at the same, so it hasn't increased any? Excellent. That's what I like to hear. So you don't need to use the sock aid to put your other sock on. However, if you want to use it just so that you don't break that 90-degree precaution, I can give it back to you. What do you prefer?
I can try doing it on my own.
Okay, sure. Good. All right, so next we're going to focus on your shoes. So go ahead and grab your reacher again. And I want you to put your shoes in a position that you feel will be most comfortable to put them on. Good. Nice. And now I want you to reach over here for this red and gray piece of equipment. Have you ever seen one of these before? Got it. Good, nicely done. So this is what we call a long shoehorn. So you're gonna hold the red handle exactly where you were holding on to already, and you're gonna stick the bottom of the equipment into the heel of your shoe and pull back just a bit to keep the heel of your shoe open. And now I know it's tricky because typically when you put your shoes on, you like to wiggle those toes and turn that foot to get your foot in all the way, but you have to keep your toes pointed to the ceiling and you cannot turn that foot at all. So this is going to be really useful in keeping your shoe in place, okay? So I'm going to give that back to you. We're going to start on your affected side.
Can I bend my knee?
Yep, you can bend your knee as long as you're not wiggling those toes at all. Keep them pointed nice and tall to the ceiling. Good. Just slowly slide so that you're not wiggling at all. Very nice. How did that feel?
Good.
Good. Do you think this is a good length for you? Because we do have shorter ones.
I think just because my legs are longer, it helps a little bit.
Perfect. Good. And then you can use it again for your other side. Otherwise, you can put that other foot in exactly how you please. Good. All right. So now we're going to go ahead and introduce your walker. Have you worked with that at all yet?
Not yet.
Okay. So I'm gonna bring that over here, and I'm gonna teach you about some of the safety features on here, and then we will get you up and moving. I'm gonna go ahead and bend your knee just a touch. Perfect, don't wanna hit you on the foot there. Good. Go ahead. So I'll teach you how to lock it down just because it's over here. So these are your locks or your brakes, whatever you wanna refer to them as. Anytime that you are stationary, so anytime that you're seated, or you're taking a break, I do want you to lock the walker, okay? So that it doesn't roll away from you or you don't accidentally lean on it. Okay. So to do so, you're just gonna push down on these two black handles, and then to release so that you can move, you're gonna pull up. Okay. So go ahead and show me that a couple times just to make sure you got the hang of it. Go ahead and pull up, and you can go ahead and lock them again just because we're gonna be doing a transfer in a minute here. Excellent. Okay, so another feature I wanna talk to you about is your bench. If you happen to find that you are fatiguing and you're in the middle of the room, you do have the ability to push this down. You can take a seat on there, so long as you're still remaining in that leaned back position so you don't break that 90-degree precaution. And then you just lift to get it back into position. All right, so I'm gonna come over here to your right side just because this is your affected side. We'll move all of this equipment out of our way. And are you aware of your weight-bearing precaution? Have they told you about that?
As much as I can handle.
Yeah, weight-bearing is tolerated. So, in other words, you don't want to put too much weight on that right side so that you start to experience pain, okay?
Okay.
So I want for this, most of your weight to be on the left side, okay? I don't want you to focus on that affected side as much.
Okay.
I'm gonna stand behind you here. You can reach for your walker here. If you want to use that hand there, you can. Otherwise, you can push up off your mattress just for a little bit of assistance.
Okay.
But I do want you to remain in your lean back position, so don't lean forward at all, okay? And that's why I'm here to support you. And you're going to put most of your weight on that left side. So we will move on the count of 3. Are you ready?
Yep.
1, 2, 3. Stay back. Good. Good. How'd that feel? Good. Good. You can go ahead and pull your pants up the rest of the way. Excellent. How's the pain feeling?
It's about a 4 now.
About a 4, so it has increased just a bit. Okay, we can address that at the end of our session here, but for now we're going to get you walking, okay? So just let me know if it happens to become too unbearable, okay? So I'm going to go ahead and have you unlock your walker. Excellent. And we're going to be moving right over to this chair. Your right foot should stay in line with your belly button. It should always be straight out in front of you. And if it's not, then you have broken one of your precautions, okay? So make sure you keep an eye on that. You can go ahead and start to turn. Just make sure you don't angle that foot at all. Good. Yep. Nice. And then you can go ahead and back up towards the chair.
And I'm pretty straight in line with it.
Yeah, you're doing good. And then you can go ahead and lock your walker. And what I want you to do is I want you to lean back, so I don't want you to sit down at a 90-degree angle, okay? I want you to kind of lean into the chair a bit. And when you're moving, if you want, you can keep one of your hands on the walker and reach for the armrests. You can use both of your hands to reach for the armrests, or you can hold on to the walker until you make contact with the chair. It's really up to you, okay? So I'm gonna move you on the count of 3, okay? 1, 2, 3. Stay in an angled position. Good. Good. How'd that feel? Good. Nice and comfortable?
Yes.
Okay, I'm gonna go ahead and this is already locked, so we're all set there. And you did say that your pain increased a little bit, correct?
Yes.
Okay, so we do have a couple of options for you. I'm gonna lay them all out for you, and then we'll talk about what one you're most interested in, and then I will discuss with your healthcare team to see if we can make an option for you moving forward. So the first option is before you engage in your morning routine, all of your dressing activities or any exercise, you can apply a hot pack anywhere between 10 and 15 minutes, and that will work to alleviate some of your pain and reduce some of your stiffness. So it'll kind of loosen up those muscles and those joints, and so moving will be a little bit more efficient for you. Your second option is you can apply a cold pack following your engagement in your morning routine. So after you've dressed yourself and you're sitting in the chair, that application time for that is the same, anywhere between 10 and 15 minutes. It really depends on your skin and how it's responding to the heat or cold. The cold pack will also work to alleviate pain, but then it'll also reduce some of the inflammation that you might be experiencing. And then your third option is you can do both. So you can apply heat before you're dressing, or you can apply cold after you're dressing, and you can kind of tag team them. What one sounds best for you?
Both of them will sound good.
You like both?
Yeah.
Okay. So I will discuss with nursing and everyone else on your healthcare team so that we can work it into your routine so you're able to apply that hot pack before you do any sort of exercise, and then apply the cold pack following exercise. Okay, do you have any questions for me at all?
I don't think so.
Okay, I will see you in the next couple of days. I look forward to working with you. You did awesome today.
Thank you.
Have a great day.
You too.